For close to 30 years, USAID and the people of Madagascar have worked together to reduce maternal and child mortality and morbidity, protect natural resources, and expand opportunities for Malagasy people and generate economic growth. But none of this has been easy. Madagascar has experienced devastating natural disasters, political upheavals, and grave economic crises that seriously challenge progress. By expanding access to basic, life-saving, quality health care for the most vulnerable people and addressing chronic food insecurity, the American people, through USAID, remain committed to helping millions of Malagasy people. USAID Madagascar's program focuses on strengthening and expanding a network of community health volunteers who deliver life-saving interventions.
Ase miandraikitra ny ase zaza eo amin'ny mahampanentana ara-pahasalamana anazy zany dia hitako zany fa misy fiovana ary mahafinaritra mihitsy ty amin'ny faritra misy anay ty hatramin'ny nanentanana ara-pahasalamana. Satria efa hita zany fa mba misy fiovana hita maso ary hita taratra. Ohatra amin'izany mihena ny taham-pahafatesana ho ny zaza lasaky ny 5 taona. Satria anay manentana ny reny sy ny zaza moa dia mandray ny tagnana koa le zaza marary lasaky ny 5 taona. Dia hita zany hatramin'ny nanaovanay izay asa indrindra fa ny fandraisanay ny tanana ny zaza marary zay dia hita fa efa ao anatiny mba misy tombosoa ary hita fa tena mahafinaritra ny fiovana misy aty amin'ny faritra misy anay. Satria amin'ny faritra misy anay ty taloha dia mihanaka misy ny valagnaretina sy ny karazana. Nefa hatramin'ny ny fanentanana ara-pahasalamana aty indrindra ny fandraisana ny tagnana an'ireo ankizy lasaky ny 5 taona ireo dia hita fa ny hena zany ary hita fa mihamaivana sikelikely ny fahasahiranana misy eo amin'ny fokon'olona.
Programs focus on training and equipping frontline health workers at the community level to correctly diagnose and treat children with simple interventions. USAID is also helping to train community health workers who are extending the reach of health interventions deep into rural communities. These volunteers receive no payment for their time or work. They're trained and in turn commit to providing life-saving services in their villages. They're proud to contribute to the health of their communities. Despite astonishing gains in certain areas, most notably the north and northwest, malaria continues to kill thousands in Madagascar each year. By working with local and international partner organizations, USAID distributes bed nets to almost every household in the highest malaria transmission districts in the country.
Dia mampiasa ny lay odimoka, lay misy odimoka, mitondra fahasalamana. Ny retina moa tsy misy amin'olombelona ndrefa zany tsy matetika famahalana hatraminy ampiasana ny lay. Ary afaka mampidi-bola rehefa salama.
We finance work in remote areas to diagnose and treat children and pregnant women using rapid diagnostic tests and anti-malarials, and partner with organizations to spray long-lasting insecticide in targeted areas. USAID is on the front lines fighting this disease. Together, these malaria interventions have contributed to saving the lives of an estimated 23,000 children in Madagascar over the last 4 years. Safeguarding the health of mothers and young children is a core focus of USAID's work. Every year in developing countries, millions of mothers and their babies die during childbirth or in the first months of life. These deaths can easily be prevented by simple, low-cost, high-impact interventions. USAID is working hard to make this possible by increasing knowledge and skills, as well as access to tools and treatments to those who need them the most.
Ny asako zany mitantagna ireo sy zaza, indrindra fa zaza vao teraka 5 taona. Kisam-bolagna zay zany magnaramaso regny zaza regny zany ilanjegna. Zahagna zany zare no makatra no midy. Indrindra fô ny reny bevoka. Ampianarigny zare mandeha misafo no mandeha magnano vaccine agny amin'ny tombom-pahasalamagna isam-bolagna.
Right now, millions of women lack access to family planning and contraceptives in Madagascar, and as a result, have no choice. What would the world look like if women could choose if, when, and how often to have children? It's a world where women are happier, healthier, and more empowered. It's a world where families are better nourished, children stay in school, and parents can see a better future for their children. In Madagascar, USAID works with international partners to provide voluntary, high-quality family planning services and contraceptives to some of the most remote, difficult-to-reach areas.
Tongavanay androany zany manaraka ny programany SIFPO de l'USAID dia ny zavatra ho ataonay eto zany dia resaka fanabeazanaizana amin'ny ankapobeny ao aloha le fanabeazanaizana tsy maharitra, tsindrona, pile, kapoty, mama, vakana, dia misy ihany koa le fanabeazanaizana maharitra zany hoe le fampitsarana fiterana ho an'ny lehilahy sy ho an'ny vehivavy dia misy ihany koa le stérilé, implantant.
Natural disasters such as cyclones, droughts, and floods pose the greatest threat to Madagascar's food security. Over the past 35 years, there have been more than 50 natural disasters. In 2012, an estimated 259,000 people were affected by Cyclone Giovanna, and Cyclone Haruna devastated the southwest of the country in early 2013. Poor health and nutrition practices, low education levels, and locust infestations also threaten the country's food security. USAID provides food aid to affected populations around the world. In Madagascar, USAID food aid is targeted towards the people most vulnerable to the effects of hunger: children under age 5, pregnant women, the elderly, and the poorest families in a community. In less dire circumstances, food can be used to compensate people for work, such as building roads and canals.
Zazang président ny lalagna amin'ny union femelle amin'ny 315 jusqu'à Tsirabe. Dina ndraikitranay zegny magnatin'ny fikambagna zay mikojakoja lala. Dia lalagna to zegny dia ny sokafigny tamin'ny lalan'ny SVD ny fokotany dia ny jusque tamin'ny PDS ny fokotany jusque tamin'ny commune. Dia azahoana tombotsoa fondro zegny to lalagna. Vao maloha ny tombotsoa azony amin'izy to zegny nivokatranay moa amizao zegny efa dia maharaka edy nivokatra fô betsaka zegny ny mpividy efa nerasera aminay eto. Faharoa magnaraka zegny zay tamin'ny fotoagna taloha ty zegny sahiragna be zegny resaka marary lavitra zegny hôpitalinay. Ka amizao fotoagna zegny zay dia efa afaka mivezivezy zegny na amin'ny tomobily fogna zegny malaka an'ilay marary malaka amin'ny agnatin'ny fokotany be volampahabe.
In turn, these projects help protect communities from future hunger by providing them access to local markets for their produce, keeping them healthy, and improving their harvests. Some of the methods of using food aid include working with farmers to identify better ways to sow and tend their fields, providing improved seed, or improving their harvest by linking them with American know-how. The work of the U.S. government in Madagascar reflects the American people's dedication to bringing their assistance to the most vulnerable populations. In 2015, USAID will celebrate 30 years of this partnership. In 2013, USAID Madagascar is providing more than $66 million in assistance to the Malagasy people. USAID remains committed to the people of Madagascar.